I did want us to do a brief comparison of the promises in the NDC's manifesto and what you have actually done in office in the last 8 months, whether or not you have followed your own promises to the Ghanaian people.
We are on it gradually.
The first things you talk about is health worker motivation for quality health care. Do you think you have done that?
We are in the process.
What have you done to be in the process?
And so now one of the motivations we spoke about was to sponsor some of the, especially the health tutors in the ministry, in the health space, sponsor them to go and upgrade themselves to come back in the system to teach. And so at the moment, we're in the process of recruiting or taking applications to allow both the ministry and the scholarship secretariat to give them something. Are
we motivating them enough to also go to the rural areas where a lot of the CHIPS compound exists?
That will be rolled out after 2026.
After 2026, I see. Sustainable funding for health services. What would you score yourself on that? Let me tell you a few things under that. Ghana Medical Care Trust Fund. You're smiling already. And then decollateralize the national health insurance. Fund retention system at the CHIPS level to ensure uninterrupted 24-hour service.
All these ones you have spoken about are far, far, far in advance. They are far, far in advance. Mahama Care, for example, we are rolling out the secretariat, we've passed the legislation and all that. And the CHIPS, that monies have been paid to the various, we've decentralized it.
I think we've talked enough about that. Right. Then there's also franchising policy for health service delivery in public facilities.
That's the PPP I'm talking about.
Right. And you are also in the process of that. You say your doors are open.
Yes.
And there's also strengthening health service delivery system by providing incentives and encouraging investment in local production of medical equipment.
That is something we must speak about. Very, very, very important in the health sector. Okay, so it is His Excellency John Dramani Mahamad's expectation and vision to make Ghana what we call a pharmaceutical hub.
Right.
So as we speak, we import about 70% of our medications or medicines we need as a country. If you put the whole of Africa together, it's worse. Some countries are not even doing up to 10%. In fact, on the whole continent, we are not producing even up to 1% of vaccines on the whole continent. So His Excellency John Dramani Mahama wants to position Ghana as a pharmaceutical hub. Now, what we need are the legal framework, the regulatory framework to be able to spring on that. A strong FDA. Now, our FDA is at what we call maturity level 3. Inching to maturity level 4. We have a very strong NVI, National Vaccine Institute. So now we are looking at encouraging, the pharmaceutical manufacturers. And Monday, I'm going to meet the pharmaceutical manufacturers to discuss what some of the things they need. Government is willing and ready to even lead the advocacy within the sub-region, Togo, Cote d'Ivoire, Burkina Faso, to lift those products from Ghana. We are in talks with them about waivers, tax waivers. And so that is a major thing that His Excellency John Dramani, and quite recently, about a week or two ago, we have again invested about $50 million in the vaccine production. As we speak, locally. So as we speak, 2 private companies have taken the lead, DEK and Atlantic Life Sciences. So very soon,
to provide what
vaccines to be produced. We have a lot of various vaccines. So they will tell us which ones will be available. In fact, as we speak, their Atlantic Life Sciences is producing anti-snake serum in this country. So it's a big thing, and we are linking it to the 24-hour economy. We have a concept in it we call, under the pharmaceutical industry, we call linking farmers to farmers. The first farmers is FARMERS, and the second farmer is the PH. You understand? Linking farmers to farmers. How can we allow our farmers to produce some of the raw materials we need in the country without importing them? What are the raw materials? Starch. Either corn or cassava.
Right.
We are capable of producing those ones here. So just Monday, we have the stakeholders engagement, and it's something His Excellency is committed in making sure that at least we push the level. We have even increased the number of the pharmaceutical products that we must produce in the country. And we are also encouraging what we call contract framework. The contract framework will lock us in to be able to buy those medications locally without importing. So it's a major sector. We are paying particular attention. We are looking at the regulatory, improving upon the regulatory standards, and then looking at encouraging the private sector to come on board. There are a lot of pharmaceutical players in this country. Now we can count more than 30, 40 of them. And we are in talks with them. We are engaging them on Monday to look. Some of them are talking about how we can waive taxes on equipment that are imported into this country for production. Some of them are talking about how we'll speak to Bank of Ghana to prioritize them when it comes to the auction of the forex. You understand? Because the Bank of Ghana will always have the better rate in terms of forex. And you see, the production of pharmaceutical products in this country doesn't only give us safety or sovereignty in terms of production of our pharmaceutical products, but it also creates jobs.
But are we even providing support for those that exist already?
But you see, you have forgotten. Let's go back a bit. When His Excellency the President was in his first tenure of office, go back and check who invested in the pharmaceutical industry. We were giving them money, cash, to invest in the money. But I don't want to rush to put out what we have for them at this particular time. So it's a major thing that we are looking at.
In your manifesto too, you have plans for, mental health care in this country. But in your infrastructure plan, I didn't hear about Accra Psychiatric Hospital or Pantang or, the other ones in the central region.
So we cannot do everything in 2025 and 2026. So we'll roll it out. But the major thing we'll be doing is to integrate the mental health care from the basic level to the up.
Right.
Without centralizing it, Pantine, where Ankafo, and then there's another one, Salamdan, right? So we don't want to do that. What we want to do is that when you go to even a chief compound, you have a nurse whose specialty is attending to you when it comes to mental health issues. If you go to the health center, if you go to the district hospital, so we are integrating them right from the basic to up. So that's what we are doing.
When President Trump halted funds to some of their U.S. agencies, which affected programs like PEPFAR,
USAID.
Absolutely. The president of our republic, John Dramani Mahama, then said that alternative funding sources should be found to support, things like the Ghana AIDS Commission and other programs that depend on USAID. What steps have been taken since then?
Not only did he give the directive, he made an allocation of about 2.5 billion to take care of the gaps and the free primary health care. So we have an allocation to that effect. So people from Noguchi will request funding because of the gap to the Ministry of Health. From FDA, Ghana Health Service. So we have funding for that purpose. So that is what we call sovereignty.
I can understand what you're saying. So why will the Ghana AIDS Commission still feel underfunded and worried by the increasing numbers of infections?
Well, as for funding in this country, it will never be enough.
Okay.
There's always room for improvement.
But have you increased your funding to the Ghana AIDS Commission?
Oh, yeah. We are even doing a national program that we are even contributing hugely. We are giving it a lot of money. We are doing an international program that other countries are even coming here. At the moment, I think the prevalence rate stands at around 1.66%. You understand? We are fighting it. Even if there's only one case, we'll still continue to fight it.
The Commission is worried that we don't have campaigns running like we used to.
We'll improve
and that
upon
could
them.
be responsible.
Yes, we'll improve upon them.
I see.
It's one of
you
the
give them
issues.
the money to do that.
It's one of the issues. But you see, the truth of the matter is that the government cannot do it all alone.
Okay.
Sometimes we need to also appeal to corporate Ghana to also come in to help. Let me commend people who have been contributing to Mahama Cares, corporate bodies, individuals, and the doors are still open. Please come and contribute. We are sharing and lowering the burden on our own citizens. You understand? So, please, government will do what we can do, but I think that intermittently, let's identify these agencies or these programs and also contribute in running them.
Is Ghana pandemic ready?
We are ready. We detect the cases very early and on time, and we fight them. Since I took office, we've handled not less than 3 to 4 outbreaks. And in all the cases, they were detected very early. Cholera, meningitis, even COVID. We had a spike. And we went in quickly. And then we didn't allow it to travel or to go beyond that confine.
What about facilities that can assist should there be a pandemic?
Oh, we'll continue to improve upon them, like health facilities. Sometimes, in some cases, we have to increase your budget to be able to buy PPEs and then have the various... Now, we've been able to build some number of isolation centers across the country, but there's always room for improvement. In the health sector, there's so much to be done. I must be very
And
honest.
there's so much to talk about, but this is all time will allow.
Oh, is that so? Is that so? So, finally, what I will want to say is that we are determined to have a health system that will be affordable, that will be accessible, okay? And that health system must also be anchored on professionalism, sovereignty, sustainability. That is what we are seeking to do. Whatever will land us at that destination is what His Excellency John Dramani Mahama has directed us to do. We will take the criticisms in good faith. Those that will detract us, those that are not constructive, those that are insults, we ignore them.